BILD Calgary Region Safety and Wellness Forum. My name is Brian Hahn, and I'm the CEO of BILD Calgary Region. Before we get started with today's forum, you'll notice that today is a little bit different format than our usual GoToMeeting format. This is GoToWebinar. Today, if you have a question, you won't be able to ask it verbally, but you can put it in the question portion of your control panel on the right-hand side of your screen. We will then ask our panelists the questions during the Q&A portion of today's session. Today, we will start with the presentation, which should go for about 30 to 40 minutes, and then move on to the question period. We will go through all the questions we receive and include yours, or include as many as we can over the next hour. But if we don't get to yours, please be sure to put your name in the question box, and we'll do our very best to get you an answer later. As you know, we've been running these weekly safety and wellness meetings since late March and have had a variety of speakers, most of them pertaining to the physical safety protocols and practices on job sites. However, equally important is the mental health of our employees, colleagues, and friends. The economic downturn, coupled with the new realities of COVID-19 distancing, stress, and uncertainty, is undoubtedly taking a toll on all of our mental health to some extent. While it can be a difficult subject, suicide is very real and a very devastating outcome of mental health issues. Men are most at risk. In 2019 in Alberta, 77% of the 556 suicide deaths were men. More troubling, those in the construction industry appear to have highest rates of any profession in Canada. Today, we have invited two representatives from the Centre of Suicide Prevention here in Calgary to talk about, among other things, what we need to know about this mental health crisis and how we can help each other, including information on their BuddyUp program. Hilary Sermon, the Education Director for the Centre for Suicide Prevention, is here. She is a human resource and engagement specialist with over 15 years experience across the corporate and nonprofit sectors, including health, government, education, airlines, mining, and pharmaceuticals. Akash Asif is the Partner and External Relationships Director for the Centre. He has a business background, including a number of years in the private sector. His passion for mental health awareness and suicide prevention brought him to the Centre, where he, Hilary, and the team are actively building awareness and sharing resources with employers and the greater Calgary community. With those introductions, I am very pleased to turn over the microphone and the presentation to them for them to share their thoughts and experience with us. Good morning, Hilary and Akash.
Good morning, Brian. Thank you so much for that introduction. I can't think of a better way to frame the topic in the current environment, economic, health, otherwise that we're facing right now. And thank you as well to Lauren and Sydney for your invitation for helping to host us this morning. I'm going to begin with a note that we're grateful now in this unique and unprecedented time of COVID-19 to be able to meet on online platforms like this. That is the blessing that we are able to meet. And it's also a challenge for us because normally we would do this presentation on site or at an office or an organization. And in those instances, we're better able to respond or see if someone needs some more support or assistance. Because suicide can be a difficult and challenging topic to talk about. So if there's anything that comes up in the course of the presentation, during the conversation or after, we just wanted to remind people of the support that is available. So I've included here the number of the Distress Centre Calgary, and some of you may be familiar with this line already. It's available 24 hours a day. So if there's anything that you need support or you'd like to talk about, I encourage you to call that number. That is Calgary-based. You may also be aware of the 211 support across the province. So 211, very short, easy to remember number. That's accessible, as I say, across Alberta. So it's connecting you to a live agent who will just ask what region or area that you're in and what area that you might need support in. So whether that's mental health, substance abuse, whatever it might be, and then that individual connects you to support that you need. So I just felt it's important to open that up when we're not in person and can't respond physically to each other right now. There certainly are those supports available. As Brian mentioned, though, we have about an hour together today, and the presentation itself is about half an hour. We're going to open our agenda with some myths and facts. So understanding a little bit more and placing the issue of suicide in context. So what we might have heard or understood or not understood about suicide. Then we'll look briefly at some of the statistics that we know in Alberta and talk about what can we do? What are some best practices in responding in suicide crises? And I'll conclude with just telling you a little bit more about the work that we do at the Center for Suicide Prevention as community educators and researchers in this field. Then we'd like to spend the bulk of the presentation time really talking about the new campaign that we've launched called BuddyUp. And this is specifically around focused efforts, messaging, communication to help men in their struggles with suicide. And Akash will take us through the bulk of that presentation. And then we'll just finish with some notes about how to keep in touch with us if you'd like more information or further resources. So let's get started with our myths and facts. And as Brian mentioned, we have a chat box, and this is our chance to be interactive. So we'll fingers crossed that this will work. I have a variety of statements that I'm going to present to the group. And I'd like in the chat box, if you could just quickly respond in there, whether you think this statement is a myth, so it's not true, or a fact, or it is true. So we have a handful of these, so let's get started with the first statement. So I'll just read this out for everyone. So globally, more people die by suicide than in war and homicide combined. So using our chat box, how do we think we'll respond to this? So we think this is a myth or a fact? Okay. We've got some responses coming in. I'll give you a couple more minutes to respond. So let's go to our response. So this statement is a fact. So we know each year that over 800,000 people around the world globally die by suicide, compared to an estimated number of 500,000 in war and homicide combined. And in fact, information we have from the World Health Organization is actually stating that number to be closer to 1 million people now, or just over 1 million people every year around the world die by suicide. So we place that in the context of war or homicide and resources and energy and time that's put into those aspects, which is important, but we also know the reality on the mental health side as well. Let's go to our next statement. So more men die by suicide than women. Do we think this is a myth or a fact? And you can use your chat box to respond. Okay, a couple more minutes for responses. You might already know the answer to this one. So this is a fact, this is true. So we know that male rates of suicide are historically higher in Canada, and it's a ratio, the men die by suicide compared to women at a ratio of 3 to 1. So we know that women will attempt more, up to 4 times more than men, but men will actually complete suicide at a higher rate than women, 3 times higher. And when we talk about the BuddyUp campaign, Akash will give us some more information about why that may be and what we can do to help address this issue specifically of men in suicide.
Hillary, can I just jump in just for 1 second? I think some of our attendees are answering your little surveys in the question box, and there's just a little distinction between the question box and the chat box. On my screen, at least, the chat piece is at the bottom of the screen, and the question one is just above that. So I think you're hoping that they'll put the responses in the chat box there.
Yes, thank you, Brian. I can't see the question box, so I don't know if that's on your end or my end, but thank you. let's go to our next statement. So when we think about ages impacted by suicide, so teenagers die by suicide more than any other age group. And if we can move into the chat box, if you think this is a myth or a fact, if you could type that in. Thanks, Brian. I see your response there. Okay, let's look at what our survey says. So this is a myth, and it may be contrary to what we might believe, commonly perceive in the media or newspapers. We often hear about teenagers being most affected or women being most affected. And again, leading into the conversation we want to have with you about BuddyUp, we know that men, and it's middle-aged men, approximately ages 45 to 65, have the highest numbers of suicide. Of all the myths and facts and statements that we get in our presentations, this is probably the most common one, or one of the most common hesitations that people have when we talk about suicide. So asking someone if they're thinking about suicide puts the idea in their mind, or may put the idea in their mind. In the chat box, let me know if you think this is a myth or a fact. Great, thanks for those responses. And again, this is one of our myths. And it's, again, as I say, contrary to what some people might believe. So we know suicide is complex because people are complex, and there's no one, generally no one single cause or factor that may cause someone to think about suicide. But we do know that asking directly about suicide is best practice in suicide prevention, and it actually can reduce the likelihood that someone will attempt. So why might that be? Well, from what we know from people who have experienced suicide ideation is that finally being asked directly, it's this relief. It's like the burden has just come off their shoulders, and they feel that they've finally been able to address, or someone has addressed it directly with them. So we actually believe that in best practice suicide prevention, asking directly about suicide is a protective factor and reduces the likelihood that someone might attempt, rather than putting the idea in their mind. People who think of suicide want to die. What do we think about this one? Do we think this is a myth or a fact? Great, okay, I can see some coming through. Excellent, thank you. So this is a myth. So most people who think about suicide do not want to die. They just want their pain of living to end. And that is a different thing. So when we're struggling or in distress, it's more about that release of pain and moving through pain rather than that wanting to die. So when we think about approaching someone in conversation or support, really moving through that pain and understanding where that distress and where those crisis points are can help us with that person, moving them forward. So we talk about suicide burden. So in an individual level, yes, it is a mental health crisis, but it's really, in our opinion, a public health issue. So all of us are just affected in a population level of suicide. Research used to tell us that up to 6 people were directly affected by a suicide death, 6 people. Now the research is telling us it's up to 135 people directly impacted around the loss of that life. So the individual who's lost their life to suicide, 135 people around them. And again, there's a ripple effect through our communities and our workplaces as well. We also know from research that a financial cost, indirect costs are significant. And we're looking at, for every life lost to suicide, is $1.3 million US. So looking now at suicide in Alberta, and what are the stats telling us? So we have some data here from 2018, probably the most complete that we have. So we have our population in Alberta and the reported number of suicides in 2018, 551. What we know, however, though, is this is the tip of the iceberg. So unreported suicides or unclassified deaths by suicide can be up to 5 to 25% more. When we look at suicide behaviors, so self-harm, attempt, things like that, they can be 40 to 100 times greater than the actual number of suicide deaths. And then general people with thoughts of suicide at any point, our colleagues, our family members, or our friends, that can be up to 5% in the population, or 1 in 20. So the population of Alberta in 2018, that would be over 200,000 people at some point may have had suicide thoughts. So when we're looking at best practices, so what can we do? What are some tools that we have available to us to help address suicide and suicide prevention? Well, the World Health Organization has identified a few best practices. There are not many, but there are a few, and education, fortunately, is one of the strongest. Also, we're looking at best practices. We have open and easy access to mental health services, and to that, I would also add early. So early access and early intervention. So if we are struggling, or a colleague or a family member is struggling early with anxiety or depression, for example, the earlier that is screened and tested and treated, the less likely it's able to escalate into a crisis point. So that early, easy, and open access to mental health supports and treatments from the very first point of concern before things reach a crisis point. Another best practice is responsible media reporting. And we are fortunate in Canada that the Journalist Forum has stringent guidelines around reporting around suicide in the media. So avoiding sensationalization, avoiding discussion of memes, those types of things. And they have a mindset guidelines that has been led by Andre Picard, who some of you might know as the health reporter of the Globe and Mail, to really lead the charge in terms of future and current reporting around suicide in the media. Another positive for us in Canada is the restriction of lethal means. So our gun controls, our pharmaceutical packaging, our transit, so our trains and bridges, all of those things are in place to help restrict and lessen the likelihood of suicide death through those means. But again, for our organization, education is seen as one of the best practices in terms of public awareness and things like we're doing right now in this webinar, and training and research. And that leads me into a little bit of what we do at the Center for Suicide Prevention. So Center for Suicide Prevention, as Brian mentioned, it's been based here in Calgary, but we are a national education center of excellence. We're a branch of the Canadian Mental Health Association, and we've been in existence since 1981 as community and public educators in the space of suicide prevention and training. So what is the work that we do? So it's really on two fronts. So the first is around the idea of secondary research. So with our team, we take all of the latest information and research that's available in the media and clinicians and leading minds and thinking minds around suicide and mental health. And we distill that down. So we take that into bite-sized chunks of information and we re-release that in terms of toolkits, articles, presentations. And we put that out to make it accessible to everyone for free. So our website has a database of resources of over 45,000 documents. We have over 45,000 items in our library, and that's the largest English language collection of suicide prevention resources in the world. So that's one piece of work that we do on the education side. The other is around community education, so workshops. We provide workshops in prevention, intervention, and postvention. And I'll show you a little snapshot of the work that we do annually. So we provide in Alberta through a network of trainers. We have about approximately 150 trainers on contract to our center, and they help us provide over 400 workshops across the province and in provinces throughout Canada as well. We have over 7,000 participants per year in our programs. We work with over 400 agencies and organizations, and we deliver approximately 80,000 hours of learning in a year. If you're interested in more resources, so whether on our training side or our toolkits, our articles, our publications, posters, whatever it might be, our website is suicideinfo.ca, and that's where you can get our online resources and also information about the workshops we provide. So some of you may even have taken or be familiar with Safe Talk or Assist. So those are two of the primary workshops that we provide in intervention skills. We also have a suite of training around issues of child and youth suicide, as well as an Indigenous stream of workshops, so suicide in the Indigenous community. And as I mentioned, our library database is the most extensive English collection in the world, and we have librarians on staff who can help with any topic related to mental health or suicide that you might be interested in. So that was a little bit about the issue of suicide, our awareness and understanding of some of the common myths and facts that we might know about the issue, and then a little bit about the work that we do at the center. Now I'm excited to turn the presentation over to Akash to talk about our latest initiative. And this is the campaign that we launched just in May, specifically around the high numbers and risks of middle-aged men and suicide. And that campaign is called BuddyUp.ca. And I'm going to share this now with Akash.
All right, well, I'll get started.
Have it.
Yeah, good morning, everyone. My name once again is Akash. Super excited to be here today. Yeah, so I'm going to be kind of running through our BuddyUp campaign focused on suicide prevention for men. Prior to kind of getting into it, though, I want to start this morning with a little bit of a personal story and why this campaign really means a lot to me on a personal level as well as professional level. So I graduated from university about 5 years ago, and I was fortunate, even during the downturn, I was able to find employment at that time. And life was great. I mean, I was able to buy new things that I wasn't when I was a student, and I just enjoyed working. And during my when I was working, one of my routines was to have weekly update meetings with a close colleague of mine and my boss, that we went over different tasks and things and next steps that we had to complete for the next week. And that became a routine, weekly routine. My boss didn't work from the same office as I did, but we got on the phone. So if you can think about it, about 11 o'clock, we would have our meetings, then we'd kind of go on our own way, around to have lunch on our own, and then around 1 p.m. every week, the same day though, we'd kind of have our team meetings. So that kind of continued on for about a year or two. And then I remember one day we had just finished our meeting, catching up, the two of us. I went for lunch, and I came back, and he was supposed to be running our next meeting there, our team meeting, but he wasn't there. And he had taken his own life during the time after our meeting and between the next meeting. And that was a very impactful event in my life, and something that really struck me heavily. And for the next little while, I remember thinking to myself, what could I've done? And maybe I was one of the last people he spoke with, and it was tough. So what I did was, over the next kind of little while, I had conversations with a lot of my friends. Most of my friends are guys, and I brought up the event with them, and I said, this is what happened. Well, how do you guys feel about this? And a lot of them told me, when we started talking about mental health, how much they were also struggling. So many of them, and then lots of them having thoughts of suicide. And that was a very eye-opening experience for me, because I didn't recognize prior to that how common it is to have those struggles. So what I did was, I joined the Center for Suicide Prevention a little while ago. And one of my big priorities and things that I wanted to focus on was suicide prevention focused on men. I wanted to help those buddies of mine, for example, that I was just chatting about, people who are struggling. And so I was given the opportunity to help out with this project with an amazing team. Not only does BuddyUp allow me to help my buddies, it allows all of us to help our buddies. So it's a really awesome campaign that I'll be sharing this morning. What we'll do is we'll kind of go quickly into how the campaign was developed. We'll move into kind of a show and tell. Hopefully technology works for us. And then we'll finish with a little bit of where we are currently and where we're going next. So what we'll do here is, sorry, next. Sorry, Hillary, I'm just trying to get to the next slide here. Yeah, so why are men at risk? I know Hillary mentioned earlier to you that it's middle-aged men that die by suicide more than anyone else, and men die usually 3 times more than women. So why is that an issue? And here are some of the things that I wanted to bring up during our presentation this morning. And the first one is that we're always often socialized not to show or express emotion. So weakness will diminish our manhood. So you hear that all the time where men are not supposed to cry, boys are not supposed to cry. I mean, I heard it growing up, frankly, and I've heard it in many other places. It's weakness, and you don't want to diminish being a man. And also, men are subject to the expectation that they'll persevere through these adverse situations. And what that does is they're less likely than women to seek help when they're struggling. So oftentimes we're told to man up, suck it up, stop being a wussy. All these things I've heard in my life, I've heard others say it to individuals as well. Oftentimes guys are just expected to move along, just chug along, and hopefully it'll pass. And once it's passed, things will get better again. So no need to ask for help. So those are some of the things that make men at risk. So what we've done is now we'll go into kind of what we started this campaign with, and that was a breakfast back in October of 2019. So give or take about 8 or 9 months ago. And what we did was to start this campaign, we wanted to bring a bunch of guys together to talk about suicide and to talk about what barriers they see. So we're fortunate to get about 40 individuals in a room together, all different backgrounds, all different demographics, age ranges. So a really good variety of guys in the room. And we had our keynote speaker, Jorgen Gilstrup, do a presentation. And if you don't know about Jorgen, Jorgen is the CEO of Mason's Construction, and I wanted to kind of share that with you this morning just because this construction industry, I know Brian alluded to as well, a lot of men, that's a high risk for suicide rates. And what Jorgen was able to do in Australia actually was build a community by giving individuals the social license to ask others how they're doing. So it's okay if you find that someone isn't doing well, it's okay to go and ask them about how they're doing, what's going on, and making it a community effort where it's not looked at as weird, it's just part of supporting your mates. So we had that presentation, and after that presentation, we had these men talk about what's going on here locally in Canada, in Calgary. What do you guys think are some of the issues and some things that we need to really work on? And the first key takeaway was stigma reduction. So like I mentioned earlier, a lot of guys, they said, I don't want to talk about mental health because people will look down on me, or I will all of a sudden, that's what weak people do, for example. There's a stigma attached to it that's not accurate at all, but there's this negative connotation about talking about mental health that stops and prevents guys to talk about it, especially with their buddies. I mean, lots of people said, I'm not going to talk about it while having wings or while having beers with my buddies. It's not something that I'll bring up. The second thing that we talked about was how do we make things a little bit better? How do we do that? And so people said, let's have a healthy work environment. So a lot of us spend a lot of time at work, in our workplace, and we meet with our colleagues and we spend a lot of time with them. So build a mentally healthy workplace. What does that look like? That looks like training individuals, that looks like having open conversations and promoting an environment where you can talk about your mental health. But something else that was brought up here was not just the junior level individuals or not just the people being onboarded, but you also need to focus on the leadership of these companies and the workplaces. So have people, have leadership, show their own vulnerabilities, show their own mental health struggles, open up. And what that will do is create a community where I don't have to worry about my next promotion. I mean, if it's between me and another person, a lot of people worry that if I open up about my mental health issues, what happens? They might take away my responsibilities. They might take away my roles. So that's something that was really brought up. And then lastly, like I mentioned, encouraging a help offering behavior. So that's similar to what I mentioned about Jorgen and made some construction in Australia, where it's okay to ask someone else. So focus on helping your buddy or helping someone else rather than focusing on the individual trying to find help themselves, because that could be really, really scary. And sometimes it's easier if you have someone who may ask you and provide that support when you need it most. So we had that breakfast. It was an awesome breakfast. It was really great feedback for us. So we got started here at the beginning of this year. So what we did was we wanted to create a project for men by men, and we wanted to include as many guys as we could. We wanted to create two outputs, a visual message, so something that people can see and recognize right away. For example, when you see a swoosh, you see Nike, for example. And we wanted to kind of create that with suicide prevention for men. And the second piece we wanted to focus on was creating a guide on how men can help our buddies. So focusing really on, yeah, we can promote helping your buddies, but how do I even help, right? So what are those steps? What can I do to really focus on providing that help? And we did that with the help of advisory committees and focus groups. So we had an advisory committee of about 10 individuals. Something of note here as well is we had females on our advisory committee as well. A lot of guys spend a lot of time with women in their lives, and women also have a great perspective. So we didn't want to miss that in the strategy of this campaign. And then we had focus groups who really vetted this campaign. So we had them look at these the message that we're portraying and bringing out from both kind of an individual level and a group level. So how do you feel about this? Would this resonate with you, this message, if you see it at a bar, a restaurant, your sports team? And then we asked them, how would your buddies feel about this? Because we know that often guys who are helping us right now, those guys are probably interested in mental health. But what about their buddies or their groups that they belong to, who may not know a lot about mental health, or that may not have crossed their mind? Would this campaign resonate with them? So that's kind of what we asked the focus groups. And together, what we did was we were able to create, oops. Sorry, it's just lagging sometimes, so I'm just trying to make sure I click through it, so I'm not going through like 10 now. Actually, so what feedback did we receive from the advisory committees and the focus groups? So I mentioned a couple things, and we had a ton more, but here's some of the points that I really wanted to bring up. It's obvious that some men, it's hard to talk about their emotions. So how do we get there? And so in our groups, we talked about using traditional masculine terms and such as courage and being loyal to your buddies, but making that about suicide prevention. So keeping the pieces and the terms, but using them to actually help your buddy. So yeah, have the courage to offer help. Be loyal to your buddy by looking after them. So it's that whole asking them, promoting that help offering behavior once again. And then also, we want to have resources, or guys said we want to have resources on how to help. So going back to my whole piece about having a guide, a step-by-step way on what you can do if a guy tells you they're struggling with their mental health or having thoughts of suicide. Once again, during this campaign, we had this vetted out. People said we want something concise. I don't want to read something for 10 minutes. I want something that I can quickly open up at a bar or a restaurant or in my workplace, spend 30 seconds, get what I need to do and move on and hopefully help my buddies. So we wanted to keep all those pieces intact. And then the last piece here is, how are you really doing? So not everyone with thoughts of suicide will look distressed. And that just comes to a really important point that I'll bring up in a little bit here, my next slide here, but not everyone is going to have a frown on their face. Not everyone is going to look completely distressed. That's what makes suicide very complex. Someone may look perfectly fine from the outside, but have struggles inside. And that's something we need to be careful about. And then also really focusing on active listening and creating a safe space. So yeah, you can promote that help offering behavior. You can ask someone how they're doing, but then you actually have to engage in that conversation, actually listen to them, and actually create that safe space so they feel okay to talk about it. It shouldn't be that you ask them how they're doing, and then your next question when they tell you they're doing not so well is something along the lines of, how are the Flames gangs doing, or how are the Flames doing, or how the Stampeders doing. So actually listening and focusing on that conversation is important. So next, I'm just going to spend a bit of time on showing you what the campaign looks like by clicking on the BuddyUp.ca website. So I'm just going to get to the next slide here. All right, let's see if I can open this up here. All right. Oh, I may have opened it up a couple of times, so I apologize for that. But like Hillary mentioned, the website is www.BuddyUp.ca is our campaign. That's where it's being housed. And so I'm going to now show you what the website looks like. So when you go on to www.BuddyUp.ca, you will see, you'll be taken to our Center for Suicide Prevention website. And once you get down here, you can see that here's our campaign. So I won't spend a ton of time going through the website here with the campaign, but I'll go through a couple of important elements. So currently we have 4 different characters that we're using to portray our message of, hey, name, how are you really doing? So you can see, like I said, you need to have some recognition. When you see Buddy Up, for example, with the fist pumps, you recognize, yeah, suicide prevention for men. The other piece that I quickly want to show you guys as well here is, not everyone looks completely distressed. I mean, if you look at Amir that comes up pretty quickly here, he looks put together. So that goes back to my point earlier about not everyone is going to show that, but everyone is going to have warning signs. So yeah, he might look from his appearance that something's not going wrong, but there are going to be warning signs that you can look at as well. So right now we have an individual who's in the trades. Liam seems like more of a gamer, university student, and then we have Amir, who's a business professional, and then we have Chris as well, as a healthcare professional. And just recently we released Jim. Jim's not on this graphic currently, we're just uploading that soon, but Jim is an elder senior who we're including in these as well. So what I'm going to do is, if you go down on this website here, there's a table of contents that's provided here. So you can talk about how to talk to someone you're worried about, or be a champion for Buddy Up, which are 2 things we'll talk about next. There's other things like statistics and warning signs. But what I'm going to talk about next is that guide that I was talking to you about. So what does it look like having a conversation, how to talk to someone you're worried about? So this infographic was created with 4 steps in mind. So I'm going to zoom in here, but there's 4 steps. Like I mentioned, concise, easy to read, and something that you can take a picture of or have in your offices. So it starts with saying men have a suicide rate 3 times higher than women. And guys, here's what you can do. So the first step is, I'm not going to go completely into these steps, but you're welcome to go on the website, download this, print it yourself, is to pay attention, right? So notice any noticeable changes. Is someone drinking more than usual? Is being more irritable or angry, or talking about how much life sucks? Those are all potential warning signs. then what you can do is you can start a conversation with them. So choose a comfortable setting. So that could be talking to them over the phone, or that could be over drinks, or that could be over coffee, or while working on a project. What's interesting here that I'll bring up is a lot of guys that have participated in this project said, I'm willing to help, but it needs to be an intimate setting, and I don't want to make eye contact. So why not have a conversation in a car? So that's something that a lot of guys thought, that's something I can do. So that's where this picture comes in, and this idea while driving the car comes in, is you don't necessarily have to make eye contact, but you're together and you can create that safe space and have that conversation. So the next step here is keep it going. So this is another thing that was incredibly important for us to look after, was keeping it going. So a lot of guys said, I might ask someone about their suicide thoughts, but if they say yes, what do I do next? Because I don't know. I mean, half of them said I would probably switch the conversation. So keep that conversation going. Follow up with them. Don't make it seem like they're overreacting, and don't change the subject. So, and if you are worried about them, ask them directly. Like Hillary mentioned, you're not going to put the thoughts in their mind. Ask them directly, are you thinking about suicide? And if he says yes, don't panic. Let them know you're there for them. And then the last step here is to stick to your role. So we're not expecting you guys and gals to be a counselor. It's more important to be a friend. So get them the proper support. Call Crisis Service Canada together if that's the right approach. And if they do have imminent plans to die by suicide, call 911 together, ensure they're not left alone. So that's a really easygoing infographic that you can have. You can print out at any time. And also I'll chat about what else you can do with that. But yeah, if we can go back to our presentation now, I'll quickly conclude kind of where we're at now. All right, so awesome. So as Hillary mentioned, we released this campaign last month in May. Due to the current environment and the pandemic, there's some things that we had to kind of move to stage 2 that I'll talk about. But what stage 1 involved was launching the campaign on our social media. So you can see that on the left there with Twitter, Facebook, Instagram. There's Jim as well. Like I mentioned, we just recently released him. He's an older senior on the left. And then also we were very fortunate that Pattison Outdoor Advertising gave us a donation for 2 months of using this campaign on their billboards as well as their transit ads as well. So here are just some of the examples of what we've been doing for the last month and so here, social media, as well as here's some examples. For example, there's a billboard of Amir, and then a couple of train billboard ads or advertisements listed here as well. So we've had tons of extremely awesome feedback. People are loving what we're doing, and it's really, I think, resonating with a lot of folks so far. So where are we going next with this campaign here? So our next stage here is what we want to do, and our goal was, once again, if it wasn't due to the current environment right now, we would have done this earlier, but we want to do this a month-long campaign that we're tentatively planning for September of 2020, so in a few months from now. So we're planning this campaign. Obviously, things can change depending on the environment. And what we are looking for you as well today is to become a champion. So take this campaign to your buddies, regardless of your gender. Anybody can take this to their buddies to help out guys to prevent suicide prevention. So that could be your workplace, sports team, social media, religious community, many other settings that you belong to that you might think could benefit. And what can you take? Some things that I didn't show you today, there's social media, but we also have designed some other print materials that you can take with you to these settings. So posters, infographics, we kind of touched on today, but we have also coasters that we can put in different restaurants that you may visit, bars that you may visit, or even your boardrooms in your workplace, stickers that you can put on your hard hat, or stickers that you can put on your laptop, and lastly, some air freshener. So that goes back to the point of having a conversation in a car. An air freshener may prompt a conversation when someone asks you what that logo is in your car. And there'll be some sort of competition for you to win a grand prize throughout that month, just to kind of make it a bit competitive and a bit fun in that way. So to kind of conclude the presentation, keep in touch with us. If you are interested in being a champion, we are currently looking, and it would be awesome to get you on board. Or if you have any questions about the BuddyUp campaign, feel free to reach out to me at my first name Akash at suicideinfo.ca. You can also reach out to me via the BuddyUp.ca website. And then for any questions around our education or training, definitely connect with Hillary, and her email address is hillary@suicideinfo.ca. And that is, yeah, that.
Thank you, Akash and Hillary. Thank you very much for that great presentation. Very valuable information. I do have a bit of a confession to make. I was steering everyone to the chat, and apparently only the organizers have access to the chat. And so everyone was providing their answers in the questions, which you guys can't see. So as a GoToWebinar rookie, I probably should have been updating you on the answers in the questions. I can tell you we got robust response and generally pretty on-target answers to your questions on myth or fact. So thank you for those. I do have a few questions, and I invite everyone that would like to ask a question to please enter it into the question section, and I will happily share that with our speakers this morning. But maybe just to kick things off, I'll start. I think this one probably is for you, Akash. BuddyUp clearly is a really good program, well-timed. It's a bit early days given that you just started it last month, but are you starting to see a little more openness in industry and businesses to mental health? Or is it still, the whole discussion around suicide, is that still heavily stigmatized? And really, to the extent that's correct, how do we start to address that in organizations and with employees?
Yeah, maybe I'll start kind of answering, and maybe Hillary, if you want, you can jump in at any point. But I think as for the BuddyUp, I mentioned it has been about a month and a bit so far. So I wouldn't necessarily say there's been a lot of change. That's at least that we can significantly figure out right now, analysis-wise. But I do think that we've gotten a lot of great feedback from it. So what it has done is, through our social media, for example, when we have brought out this campaign, a lot of different companies and organizations have followed up with us and said, how do we bring this to our workplace, or how do we bring this presentation or to our setting as well. So that has been incredibly successful, in my opinion, thus far, and that is the goal. We want people to be open to talking about it. As for kind of the other piece that I'll really touch on is I think when it comes down to organizations and companies, I think you always need a champion. So that's currently what we're looking for, someone who's willing to take this to their setting, someone who is, it's a lot easier if an employee connects with their company than, for example, myself. So it's awesome to have champions, but more importantly as well, I think it's important to have leadership also show interest in what's going on. So like I mentioned, being involved, showing a bit of vulnerability themselves, and just being open to the idea that it is okay to talk about suicide and mental health. Hillary, do you have something to add as well?
As Akash mentioned, the campaign really has two areas, and the first is that visual message. So the very simple steps that organizations can take, very first things, is to bring in our resources, or to bring in our coasters or the air fresheners with stickers. And it's that visual reminder or visual allowance, and what Jorgen Goldstrup of Mates in Construction talks about is that social license. So it's that permission to start having these conversations and to create that visual or that reinforcement that this is a workplace, or this is an organization or an agency where it's okay to talk about these things. And it's just a reminder that we have this information here, and it's a conversation, if you like, stimulator. So it's a conversation initiator. And then on the BuddyUp.ca website as well, which Akash showed you, we have the infographic, but we also have a toolkit. And that's for people who really want to dig in a little bit deeper into the background around men and suicide and men and mental health. And then more, you know, I really do have someone that I'm worried about in my personal life or in my work life. Where can I take this conversation with this individual? So the first is really that reduction of stigma and raising awareness and having those conversations and allowing permission to have those conversations, and then drilling down into the detail that we can also support further with some of our training for anyone who's interested as well.
Thanks, Hillary and Akash. There's a question here posed by one of our attendees today, and it says, both of you mentioned having leadership show their own vulnerabilities, their own mental health struggles. When sharing, do you have tips for leaders in opening up and doing it in a way that doesn't make it all about themselves?
Yeah, I can definitely start with the answer here. I think to me, I think it's by allowing pieces like the Buddy Up campaign to come into the workplace, right? So I think that would be a great start, and it shows that those individuals really care about the cause, and then being involved. So for example, I mentioned that there might be a competition, and that competition might be sharing instances of helping of when you've helped a buddy, for example, or actually that would be kind of it. So doing and being a part of the campaign is also important. So I think it kind of goes with two pieces for me. Sorry, I'm just thinking out loud here, but first piece is kind of bringing it in, but then also participating with it as well is what I would think. And then when you have those conversations, don't completely shy away from it is what I would at least want to say. If someone else is opening about their mental health struggles, it's okay for you to also show a little bit of vulnerability, and that might just get that individual to really trust you and build that rapport and maybe even really open up.
Thanks, Akash. Hillary, anything from you?
I think, as we all know, you know, mental health is the continuum, right? I mean, these are not just one-time conversations. And I'm so impressed. If you've been doing this, did you say monthly or weekly, your safety shares on different topics? That alone, that shows tremendous leadership. And the fact that you make mental health or any broad range of issues part of your general culture, your sharing culture, that we're going to talk about this and we can continue to talk about this and encourage people to share on an ongoing basis, that's true suicide prevention work. That's true collaboration. And that's how we all build the safety net that we all need, whether it's in our workplace or our communities. So just to add on to what Akash said, it's not a one-time conversation, and we just show that we're an organization where we can continue to talk about this, and we're going to continue to learn, because there's always new information that's coming out, and not one of us has all the answers, but together we can have many different answers.
Thank you for those kind comments, Hillary. I think they're actually really a reflection of our membership, who helps us drive to these weekly sessions and really looks at the safety and well-being of their teammates and workforce as paramount. And that really has come through in this public health emergency we're all navigating through. There is another comment in the questions there that I'm going to bend a little bit and turn into a question. And Akash, this may be a little awkward because I am bending it a little bit, but one of our attendees said that they noticed the Buddy Up campaign on billboards, and you talked about other means of getting it out. Maybe just recap for us what we can expect to see, and I know you had a slide on it, but what you can expect to see in the coming months. Much as we've talked about how challenging that the COVID-19 issue has been so far, it's quite possible that some of the biggest challenges are yet to come. And so I'm hoping that there'll be a continued amp up of the awareness around this. Maybe you could just share a little bit about that again, and tell us just a little bit more about what's coming up in September, October, and later into the fall and winter.
Yeah, no, of course, I can definitely chat more about that. So as I mentioned right now, because things are just starting to open up, it's difficult to implement print materials such as posters or coasters in different settings at the current moment right now. I think people are just trying to get their feet on the ground with trying to open up their businesses. But over the next few months here, what we're going to be doing is we're going to be looking for champions. Those champions will be taking those print materials such as coasters, air fresheners, stickers, posters, or that infographic that I showed you into their settings. So what I mean by settings is workplaces. That could be your church, for example, or that could be just your sports team. So wherever you belong that you might think it could work. And our plan here is we want to continue on with this campaign throughout the year by adding more characters, for example, adding more resources, adding bits and pieces throughout the year. But we really want to focus on it in September of this year at least. And that's also going to coincide with our World Suicide Prevention Day, when we really can focus on a month-long initiative that's focused on men and suicide prevention. So during that month, what we're going to be asking for our champions is to have those posters out for the month of September, if not longer, to bring out those coasters when you're serving your patrons at a restaurant for the month of September kind of thing. So we really want to highlight it during that month. During that month, we're also going to do other resource pieces as well. And then moving forward, like I mentioned, there'll be additional characters, additional resources, but we do want to make this an annual thing. We do want to make this kind of a thing where once a year for a month, we focus on suicide prevention for men, and we do that by taking materials to our settings.
Thanks, Akash. Just a couple more questions. I know we're getting close to time here, but if you could just indulge us here for a second. And you talked about, both of you talked about this in the presentation, about conversations about suicide are hard to start, whether you're the person struggling or trying to help a friend or a colleague. What messages, what kind of big messages and headlines would you like those on the forum today to know about having those conversations? And a question for me, and Akash, you kind of framed it in a different way. How are you really doing? For me, it's how do you get past the answer, I'm fine, and really drill into how someone's really doing?
Yeah, no, I think it's to me the way and it would be kind of, you're right. I think a lot of times, even I do it all the time. My buddy asks me, "Hey, how's it going?" And I say, "Good. How are you?" And then he says, "Good," and we move on with our conversation. So it happens all the time with me currently right now. I think to me, it's actively listening to what the individual is saying during your conversation with them, and then picking up on the warning signs, right? So are there changes in their behavior? So yeah, it's I think it goes past just that maybe sometimes that small start to a conversation, but then noticing that when you start having that deeper conversation, things may be different. This individual might be more irritable, or they may get angry a lot easier than usual, or they may be talking about how much life sucks. So I think a lot of it comes down to picking up, actively listening when you're having these conversations. So it's not about just, okay, I can't wait until this person finishes talking so I can bring up my point, but actually waiting and listening and actively engaging and seeing if there are any changes or any warning signs.
Thanks, Akash. Hillary, anything to add to that?
One of my favorite content pieces of the BuddyUp.ca website is it's at the bottom, and it talks about us being friends and not counselors. And Brian, you asked, so what's a takeaway message or a message to highlight about having that conversation? And some of the people on the webinar today, you may have had that conversation. You may have had it more than once. Others of you, this may be the most uncomfortable, unsettling idea of even beginning to remotely start that conversation about suicide. And then even more frightening or unsettling can be, what if I ask someone and they say yeah? So remembering that any one of us can be that person to reach out and help someone at risk. We don't have to be a professional, because we're lucky in this country that we do have professionals who are there. So our role And the idea around BuddyUp and from the mates in construction model is that we are just connectors. So just asking that conversation, mentioning changes that we've noticed. So, sometimes when someone is acting that way that the person is, looking like they do, saying the things that they do, they might be thinking of suicide. They might not be, but they might be. And if they are, how can we just be a friend to reach out that hand and just say, I've noticed some things might be going on for you. Do you want to talk about it some more? Or can I help you find someone that you can talk to? And that can be anyone. That can be someone within the company, HR, or that can be a doctor, a counselor, whatever it might be. But our role really in the context of BuddyUp and in general community-based suicide prevention is to be that friend.
Well, thank you very much, Akash and Hilary, for those answers. I do note that we actually are now running over time, and I know probably many of our attendees in their schedule have to get on with their days. I took a bunch of notes, and I could probably spend the balance of the morning asking you questions here, and I can't begin to express in words that do it justice how grateful I am that both of you would take time out to talk to us about this ever so important topic, and it's such an issue in the current environment. So thank you very much to that. I'd also like to thank everyone who logged in this morning and having patience with us, AKA me, as we cut our teeth on a little bit different technology. Thanks for that. Truly encourage everyone to accept and adopt health and wellness best practices as a priority, particularly mental health and wellness best practices. It's going to need to be a focus for us in this very uncertain environment we head forward to. And certainly the health and well-being of our industry and our community is dependent upon continued efforts as companies and individuals. As I said at the outset, a recording of this meeting will be available online later on today at www.bildcr.com under our COVID section. And I want to thank the BILD staff, particularly Lauren Herschel, our manager of communications, for organizing this and reaching out to the Center for Suicide Prevention and organizing this, a very worthwhile undertaking. And once again, Hilary and Akash, thank you for your time today and so willingly sharing your strength and your hope and your experience in this very difficult topic. And thanks to all for taking time to participate this morning. Until our next session at 8 a.m. next week, keep yourselves and others safe and well. Have a great day and stay healthy.